Memory loss is very common in old age, but how will you know when it becomes a way more serious problem? I'm here to talk about the terrible disease also known as Alzheimer's. Many people progress it differently at different stages and at different times, but typically there's 7 main stages that a person will go through if they do develop Alzheimer's. Stage 1 is known as little to no impairment. At this stage, there is no detection of the disease. Family members and even the person that has the disease will not even know that it's there. Stage 2 is known as little decline. This is when a little memory problem starts to happen. They'll develop minor problems like losing things around the house or just forgetting typical details like most of us do. And if you take them to the doctors, if you do think there's something wrong, they will still do a memory test because it is very unlikely to detect still at this stage. Stage 3 is known as mild decline, where people will begin to notice the memory decline. They won't be able to find right words while speaking simple sentences. They have a hard time remembering typical names that they should know, and they have a hard time planning and organizing events. Say Christmas that they throw every year, they will have a hard time planning it. Stage 4 is known as moderate decline. It is very clear at this stage that Alzheimer's is present. They forget details about their own life, say their family friends, or where they grew up, or what they used to do when they were younger. They have poor short-term memory as well. They might forget what they ate for breakfast that day, or forget which store they just went to. At this stage too, they also have financial problems. They will have a hard time keeping up with billing, so if they're on their own, they will have a lot of financial problems. Stage 5 is known as moderate to severe decline. At this stage, they'll need help with simple daily activities because they will need help with bathing because they will not remember how to do it or even remember to bathe. And they will also have trouble going to the bathroom by themselves. They become very confused by their surroundings. They'll be confused even if they're at their own house. They will not remember. They can't remember simple details still, and they cannot dress on their own. I know from my personal experience, my grandmother has Alzheimer's, and we went to pick her up for my graduation from high school. And, you dress nice for a high school graduation, but she was dressed in her pajamas because she thought that was right, and she just didn't know any better. Stage 6, this is known as severe decline. They need constant around-the-clock care, and typically from professionals because it is very hard to do it on your own. They get confused about their surroundings still, about their hometown even. They have personality changes and mood swings. I know too, for my grandmother, she would have trouble remembering where she placed things and often place the blame on my family and say that we stole things from her, and it was a lot of personality and mood swing changes that we had to deal with. They also need help going to the bathroom at this stage and bathing, and they have trouble recognizing their family members and their loved ones. My grandmother calls her son sometimes her husband because they just get it confused. And they wander a lot at this stage because they're just not aware of their surroundings or what they're doing at the time. The final stage, stage 7, is called very severe decline. This is the final stage of the terminal cancer, and it is awful time. They lose ability to speak, walk, and even swallow on their own and need around-the-clock care. This is a very depressing and awful disease on the patient and the loved ones, and until there is a cure, there just needs to be more awareness and more patience with those suffering from the disease.